NSN has launched a new campaign that explores how pharmacists are filling healthcare gaps in the United States. At the 2026 NACDS annual meeting, we sat down with key retailers to see how they are filling gaps in the communities they serve. Today's guest, Rick Gates, Chief Pharmacy Officer of Walgreens. So Rick Gates, thank you for sitting on with us. You've always been generous with your time, and we appreciate it again this year. So you just spent the last year as NACDS chair, and I'd be remiss if I didn't ask you a quick question about the last 365 days.
Sure, it's 363, but yeah.
I'm sorry, okay, 363. So how was that?
It's been a lot of work, but I think it's been very productive. And I feel like as we sit in with the board, as we meet with other associations, as we talk to legislators, you can start to see some momentum coming behind the messaging that we have, what we're trying to achieve. Obviously, PBM reform got through this year. Mm-hmm. So I feel like we actually put some wins on the board. The other thing I'd say is we're doing a lot to really set up NACDS for the future. And so a lot of work being done there. I think it's going to be very fruitful in the years to come.
Yeah, good. So this year we're talking about healthcare gaps, and filling those gaps, and obviously with pharmacy, it's the perfect time to do it. So think about your footprint, and what gaps in your footprint do you think Walgreens is uniquely positioned to solve?
I will talk Walgreens, but I just say pharmacy in general. If you look at the access that pharmacy has across the country, especially in rural markets, and the stat that they always have is 9% of physicians practice in rural settings, but over 20% of Americans live there. So there are healthcare gaps all across the country. And so I think there are a lot of ways that pharmacy and Walgreens can lean into that. So I think you have to understand what gaps they have in those markets and how do you actually step into it. So it could be things as simple as having virtual care tied to pharmacy to make sure people get on therapy and stay on therapy. It could be things like advanced adherence programs for those that need to obviously have better outcomes for what they're doing. But you're seeing more and more they're stepping into things like test and treat, or even things like testing for diabetic medications and titrating their doses based off their A1Cs, right? So all of those things I think pharmacists can be trained to do. A lot of them already can do it. The question is going to be how to create an ecosystem where they can actually do it consistently and get paid for it. You have to pay for it too, right?
Okay. So and you touched on this because PBM reform passed. And so now let's think about scope of practice expands. Are pharmacists ready, even for those who haven't done it in a while, are they ready to step in and start doing the work?
I think we have to be thoughtful on training. We have to be thoughtful about how we get individuals stepping up to do those things. But I think they are. I think by and large, when we talk to our pharmacists, they want to do things outside of dispensing. They want to do things about needed therapy. They want to do things to make sure patients are getting their outcomes. And I think when we start to roll these things out, as long as they understand that we're freeing up the time that's necessary for them, they will absolutely want to do it. I think consumers continue to tell us that day in and day out. I talked today a study that was done by Morning Consult that came out and said 80+% of Americans want pharmacists to do test and treat, right? And so Americans want us to do it. It's on us now to skill up and to make sure we lean into those gaps, right?
Okay. So you spent the last year, and I imagine some of those trips have been to Capitol Hill, talking to policymakers. And so in terms of convincing them that pharmacy is ready to step in and fill healthcare gaps, how would you convince them about that?
I think they have to look at it in multiple ways. Too often we just talk about scope expansion and payments reform. So ECAPS is the one that you always hear about, right? So payment for Medicare Part B for those services. But I think we also have to talk to legislators about enabling things like efficiencies in our stores, enabling micro-fulfillment in states that you can't do it, enabling centralized services across state lines, because you kind of have to do both. And if we're able to move legislation along to make us more efficient, then our ability with legislators have them understand that our pharmacists can absolutely do that because they have time to be able to do those things. I think they both have to go hand in hand.
All right, Rick, thank you so much.
Great to see you.
And congratulations on the last year.
Yeah, thank you so much.
All right.